Hi, everybody. First of all, I cannot express how grateful I am to be here. It's always been my dream since I was a little kid to come to Nijmegen. So today I'm going to talk a little bit about machine learning, why it is important in our future of digital health, the challenges with them, and what we're doing to solve this problem. Machine learning, we'll go to the next slide. Machine learning is actually, it has a mysticism to it. This is actually the formula for machine learning for the most part. It's Bayesian theory, but you don't have to worry about that today. We'll go to the next slide. Basically, it's what is the probability that A happens if B already happened. That is it for machine learning. So if we go to the next slide. So one of the things that marketers have figured out is to use machine learning. So they actually take a look at your receipts on your tickets when you go shop at the grocery store. And they've actually figured out, based on the relationship of the ticket, that you're more likely to buy beer if you already bought diapers. So that goes to show how stressful it is having kids. Now, why can't we do this with healthcare? Why can't we use the information to maybe predict or even assess folks without the intervention of a practitioner? And the problem with that is actually data. It's very difficult to acquire data that we can read. It's very difficult to do so, especially in mental health and cognitive areas. So one of the things that we're doing is, 17% of data every year goes away. It gets washed away. It's a terror. We'll go to the next slide. One of the things that we did at the Center for Autism Research is we try to figure out a way to centralize this data. Children with autism, notoriously difficult to get to the lab. An average experiment, which gives you just enough data, would take 4 to 5 years. So what we did is we developed this online battery, and then we opened it to the world. We said, hey, parents, do you think your child might have autism? Take this battery and let us know the results. We'll go to the next one. Universities all over the planet started using it, from the US all the way to China, and all of a sudden we collected the biggest repository on this specific issue on autism ever, and it still is. And one of the things that we did with that data is inform the assessment. So now we have relatively good sense if a child has autism based on how they detect faces. So if they are able to tell the difference between a happy face and an unhappy face. We're trying to do the same thing across a different spectrum of diseases. So now we're working on anxiety. Ultimately, our goal is to form the largest repository of human cognition ever created, and we're doing so now in San Francisco with the help of our partners. I would love to talk to you if you're interested in participating in one of these programs, or if you're interested in having access to this data. We're opening it limited to researchers. And with that, thank you very much for your time and attention.